and we're on a fairly tight schedule. Okay, I don't know whether everybody heard that. We're now being recorded. So a very warm welcome to this Green Social Prescribing event. And I was just saying before in the waiting room, it's been really good to see just how much interest there is in this subject. It's something we've been talking about for a while about running. And I think it's generally must be a very sort of current subject. We get a lot of questions about it. And it's certainly, given the amount of interest and bookings we've had, obviously something that people are really, really interested in. So my name's Deborah Evans. I'm the Regional Care Farming Manager. I believe I'm spotlit at the moment, so you can all see me. My colleague Sarah Marison's here as well. Sarah, do you want to just give us a quick wave? She's busy concentrating there. Can you wave? Hello, there she is. She's also here. She's the Regional Support Officer for the Growing Care Farming Project, and she's going to be monitoring the chat and just making sure people get in and keeping an eye on any sort of technical things. Just a couple of housekeeping points before we start. This event is being recorded and we will be uploading it to the Growing Care Farming YouTube account in due course. We'd love you to keep your videos on. It's nice for the speakers to see who they're presenting to, but do mute yourself during the presentations to reduce background noise. It was when we all sort of kicked off doing this 18 months ago, it's something we had to really remind people of, but I think everybody now has probably experienced the whole dogs barking in the background and children and all sorts. So yes, if you could just keep yourselves on mute, that would be really helpful. We'll be pausing for a 10-minute comfort break midway through the session, just to give you some warning. That will probably be about 10 to 11. So to kick off, let's just move my slides through. I've introduced myself and Sarah. We're also lucky to be joined today by a number of other fantastic speakers and panelists. So we've got our very own Dr. Rachel Bragg, who's going to give us some background and context on social prescribing, kick us off with that. And we've also got Dave Solly from NASP, the National Academy of Social Prescribing as well. And he's going to tell us more about the 7 green social prescribing test and learn projects, which are taking place now across England. We're also happy to welcome Jan Fotheringham, who works in social prescribing role in the Northwest. Julie Moore from Sheffield, again, a social prescribing role. And then we'll have Ruth and Wendy, both who are at the coal faces, I describe them, delivering green social prescribing at their respective care farms. Now, they're not spotlit at the moment, and I'm not going to sort of ask them to be highlighted. After we've had the break, we'll sort of introduce those. So there's going to be plenty of opportunity to ask questions, and we will do our best to call on people in order of when hands are raised, if you all know how to use the sort of raising hands later on in the session. But please feel free to use the chat for networking. That's always really helpful. I think we've, again, all been on these often enough to know that while speakers are talking and I'm busy chuntering away welcoming everybody, feel free to use the chat function as you'd like. Sarah will post sort of useful links and things like that in, and we can pick up any points and questions from in there then as well. So I am just looking at my timetable and thinking how well I've done. 10:05. So we'll kick off with Rachel, who's going to just give us a bit of context about social prescribing. So Rachel, I'll move the slide on, and if you'd like to unmute yourself and say hello.
Hi everybody, thank you Debbie. It's a pleasure to be here. I haven't got my timetable open, Debbie, so can you tell me when I'm supposed to stop talking, and I will do my best to stop talking then. And again, I'm going to apologize if I look like I'm looking over here. It's because I've got another screen with my notes on. Anybody who's heard me speak before knows I can talk for England, and I'm trying really hard to stick to time. So Debbie, if you could press the next slide, please, and I'll do the same with mine. hopefully. Yes, so what I'm going to cover this morning, I'm just going to give a really quick overview of what social prescribing is and when it started, and then talk about the range of nature-based solutions available, and then really just sort of set a little bit of context really about the sort of the green within social prescribing, and to give you a bit of a an overview of how we've been engaging with the social prescribing prescribing debate over the years, and then looking at care farming and green care in social prescribing now and how things have moved on, and then talk about sort of the way forward before handing over, hopefully seamlessly, to Dave. So next slide, please, Debbie. So social prescribing and similar approaches have actually been around for quite a long time, and have been practiced within the NHS and sort of various degrees for many years, with some schemes dating back to the 1990s. And even the Bromley by Bow Centre was established in 1984. So it's been around. It's not a completely new concept, but really for me, I think it became more mainstream when Simon Stevens, in his 2014 report, known as the Stevens report now, said that the NHS can change from a factory model of care and repair to one that focuses on much wider individual and community engagement. And that really sort of put it sort of forward and centre within NHS. So what is social prescribing? Helpfully, there are still lots of different definitions and they're sort of floating around. But if there are those people who don't know what it is, it's essentially a scheme where GPs, nurses and other primary care professionals can refer people to a range of local community-based non-clinical services to support their patients' sort of health and well-being, really. Currently, and this hasn't always been the case, more about that in a minute, social prescribing happens via link workers who are often, but not exclusively, based in GP surgeries. And the link workers work directly with the patient, and between them, together, they decide what sort of support that the patient, the person, may need. So that is my description of social prescribing in a nutshell. So next slide, please, Debbie. This is very, as we said, channeling our inner Chris Whitties here. So there are a huge range of different types of nature-based interventions out there, and they're available from a whole host of different organisations. And a number of years ago, after consultation with the nature, health and wellbeing sector more widely, as a community, we adopted some more sort of health language, if you like, to enable us better to communicate with the health and social care sort of arena, really. We wanted it to be a little bit more directive and consistent with the emerging preventative focused health and public health systems. So this is how we are communicating the services we provide. So you'll see that we lovingly call this our 3 circles diagram for obvious reasons. And we've sort of tried to make it look a little bit like a triangle to link in with the personalised care model of the NHS. But essentially, you can see that the large green circle is nature in our everyday lives. And so this is, as it says on the tin, really. And a lot of the interventions around this area are sort of more around public health messaging. And it's really the two smaller circles that certainly we've sort of been working with the most. So we've got nature-based health promotion, and this is sort of really less formal drop-in community projects, community opportunities, community farming, community gardening, all sorts of things. And they don't happen by magic, so they're still an intervention because people still run them. And this is a sort of more public health community initiatives. And then right through to the smaller circle, which is green care, which is my personal field, nature-based therapy or treatment interventions specifically designed, structured and facilitated for individuals with a defined need. There we go, a bit of a mouthful there. So a little bit of context, my area of research work and our work at the growing care farming team here at Social Farms and Gardens is to do with the topmost smaller circle of green care, and in particular for care farming or social farming, which is essentially the therapeutic use of farming practices. However, as Social Farms and Gardens, we support organisations who deliver in the two, I don't know why I'm pointing, you can't see that, I'll sit on my hands, who deliver in the two smallest circles, and as well as enabling people to incorporate nature into their everyday lives. So social prescribing is really relevant in both of these circles, and I'll highlight what's happening in practice a bit more in a little while. But let's see how our green care circles line up with the NHS model of personalised care that I'm sure, oh no, back one, Debbie, sorry. That I'm sure that many of us are familiar with, and you saw a quick snapshot of that pyramid there. So as you can see, I've tried in this sort of second level of pale blue blobs as sort of how the various green care circles or the green circles line up with the pyramid. And so green care is very much the sort of targeted with some specialist services. Nature-based health promotion is targeted with some universal, and the public health messaging, the nature in everyday life, is the universal population. So and of course, when in terms of organisationally, many organisations actually deliver activities in all three of these different circles. And of course, the other thing to mention here is what the nature health and wellbeing sector have got that perhaps other interventions haven't, is we've got this progression. You may start off with needing the green care, and then as you feel better, as you move on and progress, you may then be wanting to engage with some of the less formalized drop-in type approaches before taking nature into your everyday life, and vice versa. As people need additional support, it can go the other way as well. So with half an eye on time, I'm going to move on from that. Debbie, please, to the next slide. Okay, so this is the comprehensive model for personalised care that I'm talking about. And I just popped this in here. I think Dave's going to cover this later as well. So this is what I was talking about in terms of specialist, targeted and universal for the healthcare people on this webinar. So typically, as is always the way, we always know that boundaries never quite align. So there's a little bit of crossover, but that is basically the reason we put our little circle at the top, was to try and make it look visually along the same lines as the model for personalised care. So if you just advance it one more time, Debbie, you'll see that the green care bit is sort of, there's a little bit of overlap there's a bit in the top and mainly in the middle. So I just put that in there for information, really. So next slide, please, Debbie. So what I said before, many care farms and other nature-based interventions can deliver all sorts of different types of service, both the commissioned referrals for individuals with a defined need, as well as the more generalised, sort of more community drop-in resources as well. And but the key thing, I think, is that there are often different referral mechanisms, funding costs and support for the two different approaches. And the crucial thing here really is that we've really got to be clear about what we're offering and which one of these approaches the commissioner or the referrer needs. We need to do that to improve the clarity for both, really, for commissioners and service users alike, and to access the right people, resources and funding. And this is just as relevant in social prescribing as it is with any other type of referral, if you like. So because we need to use the appropriate language to talk to the right commissioners. And this is, as I said, just as true in social prescribing. So next slide, please, Debbie. So now I'm going to give you a bit of context about how we've been involved in the social prescribing debate over the years. So as a researcher, and then alongside Debbie in Care Farming UK, and now with the wider team and colleagues within Social Farms and Gardens, we've been involved in the social prescribing debate, if you like, for a long time, really promoting that nature-based interventions are the perfect community-based program for social prescribing, because we know the winning combination of being outside in nature, working in a group, doing meaningful nature-based activity gives synergistic benefits for health and well-being, both mentally and physically. So, as well as generally shouting this from the rooftops, we've been involved in many policy type roundtable events over the years, giving a voice to our sector to ensure that the voice is heard in the important debate over the years. And it has been, you know, number of years. And I have to, so I'm just going to sort of pop it in here that we were actually delighted to hear about social prescribing all those years ago in 2014, 15, as we really thought, great, a standardized referral mechanism and funding pathway to help our members deliver care farming or green care services to more people who could benefit from them. And yeah, so we were enormously excited about social prescribing, and it is really quite amazing how far, you know, things have come on in some ways and how they haven't in others. So in 2016, we undertook some, we did some research commissioned by Natural England to look at social prescribing in practice, to look at good practice and to generally see what's going on regarding the nature-based interventions or the nature-based offer within social prescribing. And we found a number of key barriers and we came up with recommendations at that time. And I thought it'd be interesting to have a quick look at those and look at where we've come, just to sort of put it in context. And the link to the report is there if you're interested. So next slide, please, Debbie. So this research had a number of key aims. We wanted to get an understanding of the use of nature-based interventions within social prescribing services. Particular emphasis for this report was for people with mental ill health. We wanted to provide suggestions for good practice in social prescribing services, and to provide a resource and support for those who are providing nature-based interventions, in giving them support in engaging with health and social care. So we did a literature review of all of the evaluations of the social prescribing schemes in existence at that time. And we also held a social prescribing demonstration event in Leeds, where we pulled together people from the 3 different social prescribing schemes at that time. One had been going for a couple of years, another had been going for a year, and one had literally just started. And we also brought in nature-based interventions from around the area to put people together. So I'll stop gabbling now. So, and at that time, in 2017, we found that there was no consistent or standardized referral mechanism in place, as well as no specific funding for the social prescription element in the majority, but not all, of the social prescribing services. So, i.e. no funding to the third sector service providers. But we did find that where social prescribing was working well, this was what via link workers and via the facilitator role, which I thought was really interesting when I re-looked at what we found then. That and we sort of particularly held up the Rotherham example as good practice. But the other thing we found particularly at the demonstration event, is that the nature-based options within social prescribing were not being actively promoted compared to other types of intervention within social prescribing, and they were generally being suggested only if somebody comes in and says, I would like to do something outside. So the wider benefits weren't being sort of promoted in such the same way as perhaps some of the more sort of art craft type, and some of there's a huge myriad of opportunities available. But because patients will not always be aware of the nature-based sort of how good being outside is for you, that they weren't automatically thinking of it. Now, actually, probably post-COVID, that link is probably more coherent now than it ever has been, because people have found that nature has helped them. But anyway, so going back to this, so they weren't being promoted enough. And one of the recommendations was the need really to promote the green social prescribing. And interestingly, one of the recommendations was the nature, health and wellbeing sector organisations should work together with Natural England and DEFRA to support an expansion in nature-based interventions within social prescribing, which I'll come back to this later before handing on to Dave. Just want you to sort of hold that in your mind for a minute. So that was one of the recommendations. So next slide, please, Debbie. Okay, what's happening in terms of care farming, green care in social prescribing now? Well, some things have changed a bit, and we'll hear more from Dave about this in a minute. So I won't steal his thunder by waffling on about it now. One of the interesting things that I found actually is that we've heard a lot in some of our roundtable and our advocacy discussions within health, within healthcare. We've heard a lot about the differences between the different service or requirements of patients, whether it's green care or something less formalized. And the narrative has been that it's green care that might be needed in some cases and more community-based, less formal approaches in others. But in reality, I think it's true to say that there's more green social prescribing happening in the middle circle, the less formal end, than in the green care end. And I thought it would be interesting to highlight, so this is hot off the press, the analysis of the latest annual survey for care farming and green care that happened earlier on this year. And you'll see that, so the graph on the right shows you where most care farms and green care sites get their referrals from. And as you can see from the graph, social care and educational based referrals are leading the way, with referrals from health being less frequently seen on care farms. So if you can see down here, I think I might have highlighted it. Oh no, I didn't. So social prescribing, which you can see is fourth up from the bottom there. Social prescribing referrals to care farms are still relatively small, with less than 20% of care farms receiving referrals this way. So why is this? Is it a lack of knowledge, promotion, or is it something else? Next slide, please, Debbie. So I'm going to wave the funding flag here as well. So why is it that care farms and green care providers are seeing sort of a relatively small amount of referrals from social prescribing services? Is it just a simple case of referring less service users, or are the markets less developed? We do really need to dig deeper into this to have a look at what's going on. But I think funding actually is still a bit of an issue with social prescribing. So generally, we know that referrals to green care may come with or without funding. And so the graph you can see on the right, or I hope you can see, even I'm squinting at it now, but you can see that essentially the bigger the darker bar on the line, the more places are funded. So you can see in terms of local authority social services referrals, you'll see that over 80%, nearly 85% of referrals have some funding attached to that referral. And you can see that some referral routes seem to be better at providing funding for the individual referrals than others. And social care and education seem to sort of wash their faces, seem to do better than health generally, as a general point. But we know that all green care providers, and I'm sure it's exactly the same for the community-based initiatives as well, you have to be... Most people are typically accessing all sorts of different funding sources at the same time to cover the cost of providing the service of what they're doing. And the fragmentation of funding is out there. One of the things I think is interesting in regards to social prescribing is that sports and artsy type social prescribing options have support and funding from the Arts Council and Sport England to enable them to deliver services without the funding following the individual. But the green sector doesn't really have an equivalent. Now, we have Natural England, who have been very, very supportive and instrumental in helping, and DEFRA as well, to support green social prescribing options, but they don't have a funding remit for delivery. So I thought it was worth making that point. And I think it would be disingenuous of me to say that if social prescribing is going to go beyond delivering health and well-being, or if we want to scale up social prescribing from green interventions as well, then it really needs funding. And it's probably not just the green interventions as well. If we want to be transformative at scale, we need consistent funding opportunities. Otherwise, it's just not sustainable. And this really is a key issue, but it's not been lost on the powers of be. Green care, nature-based interventions, nature and health, it works so well that we really need to look at imaginative ways to ensure that this growth can happen. And just if you could forward it, Debbie, just to highlight where social prescribing comes down on my graph. I'm hoping this will, in fact, actually comparing to the last survey, it has improved a little bit. So that's positive direction, I think. Debbie, next slide, please. So I'm wrapping up now. Hopefully, Debbie, I'm sort of on time. So what is the way forward in terms of green care within social prescribing? Well, I think the first thing to say is that we really can't underestimate the scale of change. This is an enormous shift in how health is being, healthcare is being delivered in this country. And as with any enormous change, it will take time. Now, obviously, I've been in this arena since sort of 2015, talking about social prescribing, and it is taking time, and sometimes it can be really frustrating. However, things have changed. So what I was saying before, one of the barriers that came up before was that there was no standardized referral mechanism. That has changed enormously. We now have got the infrastructure in place. We've got link workers. We've got, people know more about social prescribing. And with the initiative to create, and there's sort of a huge injection of cash to set up these social prescribing link workers. And that has come from sort of best practice examples. We know it works really well. So it hasn't all, some things have changed, and this has taken time. There is now a workable solution to the referral issue, and we're delighted that this has happened. But funding is still an issue, and we know that, but we also know that payment for an individual, rather like a clinical referral, is unlikely to happen within social prescribing. I've completely forgotten his name. Who am I thinking of? Has told us, what's his name? I can't remember his name. Has told us, I'm sure Dave will fill in later, will tell us that there's a movement to look at funding solutions, but it's unlikely that we will get a pot of money per individual to follow the social prescribing referral through. But more about from Dave about this later. So we will continue to advocate for green social prescribing, both in terms of green care and for the less formal activities. We need it all. Essentially, it provides more choice for the patient. So, but the key thing is making sure that what you're offering and the expectations are the same. They do match up. Which green, are you providing green care or less formalized nature-based activities? Is that what the referrer wants and needs? We will continue to inform the debate, looking at different funding options for social prescribing delivery providers. I'm lucky enough to be talking to the APPG on health and well-being later on this month as well, where I'll also be advocating for green social prescribing in its widest sense. And we, of course, will be involved, and we are, more about Sarah's work later, with 7 test and trial green social prescribing pilots and wider. And we are very much looking forward to the findings of these. So I was just going to, before segueing neatly at that point into Dave, I was just going to read out this quote again. The nature, health and wellbeing sector organisations should work together with Natural England and DEFRA to support an expansion in nature-based interventions within social prescribing. And that's pretty much what we've been doing. And I think the green social prescribing pilots are a result of that. And so without further ado, I'm going to say, hang in there. We've got to be in there for the long term for this. And if we're not engaged in the debate, then things won't move forward. But I'm happy to say that things have moved on. And so thank you very much. And I will now put myself on mute.
Thank you, Rachel. Right, I'm again conscious of time. That's a fantastic sort of background and overview, and hopefully that will have just sort of set that context. I'm going to hand straight over to Dave, if you're all right unmuting yourself, Dave. We seem to have developed a green streak across my screen. I don't know whether everybody else can see that, but or whether it's just me that can see it, but apologies for that. I don't know how that's happened. But Dave, yes, just let me know when you want me to move through the slides.
Thanks very much, Deborah, and thank you very much for the invitation to speak this morning. I can see nature's already intervening with the green stripe across the screen. So thank you, Rachel, for that context, which does mean that I will be skipping quite quickly through some of my earlier slides with your help, and Sarah and Debbie's help, because how do I follow that? An excellent context there. Thank you for that. So. I'm coming at this from the perspective of the National Academy of Social Prescribing. I should also mention that I'm seconded there from Natural England, so I bring in that connection to there as well, which is a great link in that relationship. Just to move on a slide, if I may, just a little bit of what the Academy is doing at the moment. Basically, our background is that we were launched in 2019 with Secretary of State for Health support, ambitions to raise the profile of social prescribing. That's what we've been working to do. We're not a funder per se, but we develop connections between people who can support in various ways, whether it be money or with activities, or whether it be links into the systems as well, and build relationships as particularly. One thing we're also trying to do is to pull together the evidence. All the evidence is out there. It's about bringing it together so that it plays in as most effectively as possible. And of course, sharing learning and knowledge is absolutely vital. And just to move on a slide, a couple of areas that we've been involved in. I'd like to just mention our multi-agency sort of regional structure that we have, which is the connection into the link workers, but it's the connection between the link workers and the voluntary community sector, and also with people who lead from different sector perspectives. We have 4 pillars of interest: the natural environment, where the connection is with Natural England's health and environment leads, sport and physical activity, where the link with Sport England, and also heritage with Heritage England, and the arts and culture through the Arts Council. And we also have a connection in for the Money and Pension Service from Department of Work and Pensions, and the value of that is immense in the number of cases that come to GPs are often about that sort of issues and concerns associated with money and income and problems around that. So that link is an additional strand that helps us able to tackle those conversations. Thriving Communities, we band much together under the Thriving Communities banner, which has in particular supported 37 local projects of communities coming together to develop their activity in social prescribing, which connected very closely to our regional leads. And if I can move on a slide to something that we've more recently done, then this is about accelerating innovation, where we've recognised that there's a range of expertise and bodies that operate nationally, but also come together nationally as well, to be able to sort of consider big picture scale ways of sort of tackling innovation, tackling solutions in innovative ways. So our Accelerating Innovation program is convening a community of practice to consider at a national level, but also with drawing in others who are operating at different scales, regional or local as well, ways to sort of innovate and develop support. And the idea of the series of wheels is that it may the community of practice may develop thinking on support that's needed and actually move further on to take a few elements forward into actually action to grow that support that's available. That's a very recent scheme that was only launched for the first time in early September. First round of applications have closed, but there will be other opportunities for others who wish to engage in that. So that's a little bit of background on NASP. I'm going to quite quickly skip through the next few slides, starting with, of course, why social prescribing. If we can just go back one, please, Debbie and Sarah. I just wanted to flag out why we're doing this. And basically, it is that sort of recognition that there is much that social prescribing can do to address the issues that are coming through the healthcare system, through GPs and what they're encountering. Slide 6. The next slide, if I may, is is important in that this is the timeline of how this is coming through. We're seeing pretty massive change here in a very quick, very short time scale. As of August 2021, there's approximately 1,500 link workers in primary care networks, and we see this is all driven by the NHS long-term plan recognising social prescribing and its value and having an ambition to grow the number of link workers. And that happened in 2019. Only 2 years on, we're seeing significant growth. The whole process is a really rapid change of a significant large-scale system, and I think it's very important to recognise this as we go through, that this is actually bringing something that, yes, we've heard that it's been active for many, many years, but it's actually bringing it into a very large and established structure, and for probably arguably for the first time, we get building on their recognition of the potential of the natural environment to help and support with people's health, well-being, and particularly mental health and well-being. So I'll quickly bring up a slide that you've already seen before, slightly different angle. This is the comprehensive model for personalised care, where Rachel ably showed where green care slotted in and recognised a lot of sort of green social prescribing interventions. They can apply across the whole a pyramid, but there's a particular emphasis on the whole population level, that daily dose of nature that can be of such great value to everybody as well. I'm going to skip right over the next slide, if I may, because Rachel has ably covered that so well and how it works, and I just particularly just skip through some of the levels of connection that people have. So what we're doing here is is developing and building in that concept of nature connection. It's more than access to the natural environment. This is about recognizing that actually people developing a deeper connection with nature is what's necessary to really get the benefits. And so understanding what that connection of nature looks like and how you can get that connection is what we're trying to achieve as part of this process as well. So connecting in everyday life, the sort of some examples of the activities that can help connect people more regularly in their their local spaces, local to where they live. Anybody can take part in these relatively easily. If we go on to the next strand, the nature-based health promotion, it takes us into those people that need further support. And some of the activities and opportunities that they may be able to connect with at different levels. It may be that not everybody is ready for a large-scale run, but just getting out there for a gentle walk or perhaps a shorter run is really helpful to actually improve people's health and their mental their health and well-being. And the final level, if I may, is where Rachel has highlighted nature as a therapeutic intervention, the green care element, which is specifically designed and focused targeted interventions to address specific needs, and at some point people may move between any one of those three levels. So you've particularly asked me to come today. If we can move on to the next one to highlight some of the green social prescribing test and learn sites and answer some of the questions that are below. You'll notice that the word green isn't purely green, and we've deliberately acknowledged that blue activity, water-based activity, has an equally important role to play in this, and is very much a way that people can get health and well-being activities. So the ambition of this, the test and learn program. If I can just move on to the next slide, please. This is, as we mentioned, this is about bringing that nature connection, bringing that sort of connection with nature, with green activities into the system. This is the NHS's own slide. I would say that some of these slides I'm presenting on behalf of the partnership that I'll tell you about shortly that's involved in the Green Social Prescribing Test and Learn initiative. And this is the NHS's description. So this is basically the bringing nature connection, nature-based solutions into the NHS system, and their recognition of its potential to help deal with some of the issues that they're dealing with, and keep people from needing that deeper intervention of the primary care system as well. If we can move on to the next slide. As a bit of background to this, where were the origins in this? Crucially, this is a very cross-governmental project. You will see along the bottom there the range of partners that are involved there. It was announced by a DEFRA Secretary of State, and the actual sites were also announced by the Environment Minister Rebecca Pow in December 2020, with comment and support from the Health Minister Joe Churchill at the time. So it's a very cross-agenda initiative, and it's part of supported by the Treasury's Shared Outcome Fund, which is intended to pilot innovative ways of working that can improve collaboration and can be delivered by multiple public sector organisations, but lead to better outcomes and deliver more for people. And it sort of complements the 25-year environment plan which sets out ambitions to help more people from all backgrounds to engage with and spend time in green and blue spaces in their everyday lives. If I can move on to the next slide, the actual project aims are to sort of understand green social prescribing in the context of the systems that the NHS are establishing, and to consider how they can grow and be scaled up, and to enable them to deliver more for all different levels of the system. Rachel earlier mentioned that, and I've touched on as well, that there are different levels of support that green social prescribing and green care can offer. So this is attempting to explore the ways that this can be taken forward from the context of the NHS in their systems. If I can move on to the next one. So it's aiming for scaling up social prescribing in local sites. It's aiming to understand what's needed. Yes, it's the work includes support for a number of test and learn sites, but the ambition is to understand what enables the expansion of green social prescribing in a local site, and the barriers that exist, and provide recommendations on the next steps. The period of its operation is up to 2023, and at this stage how the learning will be taken forward is not yet fully decided, so that will be taken stock of as the pilot progress. Again, it's in relatively early stages, with activity having been initiated at the early part of 2021. If I can move on to the next slide, please. So I've mentioned already that there are 7 local test and learn sites in place. I'll come to them a little bit more. I just particularly want to flag to you now that a couple of other elements which are extremely important. And I'll come to those a little bit later. There's the work includes a national research work to capture an understanding of a couple of elements of social prescribing, and ongoing evaluation of local and national action. And note local and national action. So that's the work of the pilots, but also looking broader to wider activity that's already happening. This is not simply intended to reinvent green social prescribing and through a series of test and learn sites. This is intended to, yes, learn from those, but also to learn from expertise from that's already in place, including your own, and make sure that's taken account of into thinking of what is necessary to make the system work as best as possible. So if I can go on to a little bit more depth on the next slide, I'll come back to focus on the test and learn sites first. You will hopefully have all noted where these were, and I'm just going to put in the chat for you a link to their contact details, which are already published and available on the web. These are the 7 places that are put forward a proposal which the NHS and the partners are working with to test and then identify barriers and enablers to what works at a local level. You'll notice that they're led by the integrated care system partner. So it's very much the health system that's seeking to understand what actually works in the context of their system and how to connect green social prescribing opportunities into there. All sites are trying to connect up with green providers across the healthcare system and build awareness and confidence amongst referrers of people who are in need and support. And there is a very strong emphasis on mental health and well-being, particularly mental ill health, and what will help to tackle that in these pilots as well. Some are already working collaboratively, oh dear, excuse me, struggling with the word, with green providers to understand the training and support that's required, and to offer support in that area, or with the ambition of what will help with them delivering sustainable services across mental ill health need. If I can move on to the next slide, that takes us into the national research work. The national research work, which is being led by the Department of Health and Social Care, is building on the insights of the test and learn sites, but also focusing on a couple of particular strands of work to understand the effectiveness of green social prescribing in a clinical sense, and also to understand the headroom, the space there is for scaling up of green social prescribing at a local and national level. If I can also move on to the next slide, that also brings us to the evaluation work, which will be following closely the 7 test and learn sites and the whole pilot project as well, to sort of learn from its experiences, what works, what's worked less well. And importantly, across those 2 pieces I've just mentioned, the research work and the evaluation, is the ambition to connect with existing providers of activity and understand what works from their perspective, all the learning that they have, and draw that in. So that also informs the thinking of how this can be scaled up within the context of the systems that the NHS are putting together. The leads on the evaluation are highlighted there, but the sites, the evaluators and the researchers are very, very keen to hear from providers and learn from all they are doing as well. And they're doing that. If I can move to the next slide, I'm almost at the end of my presentation here. They're doing that with an open invitation that if anybody would like to connect either with the sites themselves, which is very, very much encouraged, or with the research or the evaluation to feed in knowledge or to understand more, then the first point of contact is the email address at there, which takes you into the project management systems, which are led by NHS England and Improvement. Within the test and learn work, there is a great deal of emphasis on collaboration and learning from each other. And those involved, all the partners, and all, are connecting regularly with the representatives of the test and learn sites to understand their needs, understand what's coming from them, and deal with their questions around particular themes. They've recently, for example, considered issues around inclusion and how to make sure that their work is inclusive of all who may be interested and need activities as well. I can't stress enough, if you would like to connect with any of the pilots, then please do get in touch. They're very keen to hear from you if they haven't already contacted you as well. So that's a sort of a brief overview of the test and learn sites, which I'll say again, this is a big process. This is a large-scale change happening apace. Even by 2023, we'll only be sort of three to 4 years on from the first consideration, the first recognition of the potential of the natural environment and connections with nature to have a positive impact on mental ill health, and drawing that into the NHS systems. So it's really is happening quickly, and very keen to sort of arrive at something that leads us into a successful model or successful approaches for growth into something that is available across the country. I should say that one of the things that NASP also does is is able to bring a connection internationally. Recognizing that what we're doing in this country is excellent. There's a lot of good work there, but there's some learning to also be drawn from international players, and at the same time, we can also help spread the knowledge and understanding and opportunity of social prescribing around the world as well. So I hope that gives you a bit of an insight into the projects. I'll just end on one final slide, which is just a recognition that social prescribing, as of course Rachel has said earlier, it's not simply about the NHS. We've got years of experience and years underpinning great activity as well. The pilots are helping to, the test and learn sites are helping to draw the learning into the health systems of today. And hopefully they will enable that to become part of that system in an effective way. That will, in theory, be able to value all the work of community groups, volunteers, members of the public, to enable them to act and be part of this movement and make an effective contribution. We do recognise that local voluntary groups and organisations are absolutely integral to social prescribing, and they have to be fully recognised and supported and regularly heard, so that there is a two-way flow of dialogue through all the thinking as social prescribing is put together. And the NHS England and Improvement are very much considering that. They're looking at a sort of creating a maturity framework, which will help collaborative in commissioning and identify what good social prescribing looks like. And the voluntary community sector alliances within integrated care systems, the new integrated care systems which are emerging, are looking to try and connect with community groups and voluntary organisations to enable them to be hardwired into the ICS structures and decision making. And we, of course, continue to look at ways that communities involved in delivery can be supported. You've heard of a couple of the initiatives which we're supporting currently. We hope to have more connections and opportunities to come in the future. I'll stop there for now. Happy to contribute to the discussion. I hope that's helpful.
Brilliant. Thank you. Thank you so much, Dave. And thank you as well, Rachel. I think having you two together as a double act has just been really helpful, putting that all together in one place. It's probably all things which I sort of knew about, but actually hearing it all pulled together the way you two have just done has been really, really helpful, actually. I'm sure everybody else will agree. We have gone slightly over time, but as I say, I think there's so much in there. What I'm going to suggest is if there are any questions, I'm going to just stop sharing my screen so I can see everybody a bit. Oh, that's better. There we go. I can see everybody a bit better. We'll just got a couple of minutes. What I'll do is push the break back and we'll just have 5 minutes. Hopefully we can all boil a kettle in 5 minutes. Is there anybody wanting to sort of pick up on anything? If you want to raise, I can't see everybody, so you'll have to sort of raise your hand on Zoom and I will do my best to pick up on anything. If there is anybody, I can't see. Rachel, you're going to have to...
Michelle has got her hand up.
Michelle, yes, thank you. Michelle, do you want to? I don't know whether you want to sort of put your camera on. It's up to you. Hi.
Hi there. Hi.
Is there anything you wanted to sort of ask Rachel or Dave?
Yeah, it hasn't really been touched on yet. I don't think. But I wondered if in this presentation or perhaps in future, it was possible to talk about impact measurement and evaluation of green social prescribing, because I've just put it in the chat box. It's something that funders are asking for, and it would be really interesting to hear about and really useful for providers as well.
Well, I'm sure Dave can jump in on this. I mean, evaluation and impact measurement stuff has always been on the agenda. From a personal point of view, I think it's another one of those things that's on the agenda but hasn't quite been sorted yet, if you like. I mean, that's obviously one of the reasons that we highlight the Care Farming and Green Care Code of Practice for our members. It is something in a box, is a quality assurance type scheme, which is important. But I know that Craig Lister has been working on this about a quality mark as well for the community-based interventions as well. I mean, Dave, do you have anything you want to add on that? Because I mean, all I'd say really is that it's been on the agenda for a long time, but I don't think it's got to the sort of solution stage yet, if that makes sense.
No, I would agree, Rachel, and I think it's still a work in progress. There are all the activities that we're connected with do get evaluated. The Thriving Communities programme that NASP is running is already currently undergoing its first evaluation for the support that's in there. That's hardwired into individual programmes. But I think more broadly on green social prescribing, it's still a work in progress, and that's partially what the test and learn period is designed to understand, as well as actually evaluating what it's doing, capturing all the learning that is out there. It's also what works in terms of measures to evaluate, and how to capture information, and what to ask for in a way that's realistic when providers are busy on the ground. So I think they'll be learning on the evaluation process itself, as well as the actual what the evaluation says of the delivery that's been happening.
Mm-hmm. And that, I think I totally agree with David, just to add really that's why it's so important that you know what you can offer and you know what the expectation is, because if somebody is looking for a more supported program, then the signposting them to a less supportive program isn't going to help and can also sort of do harm. So that's why we talk about be sure about what you can and can't offer. But I won't say any more because I know Sarah's got some great tips for us at the end.
Brilliant.
Along those lines.
Thank you. Right. Well, what I'm going to do is give everybody their much promised break. I can see we've just had Wendy. Wendy's just joined us. Hello, Wendy. Hi. And we're going to be drawing her amongst some of the others in afterwards. But I know I know what it's like when you're just staring at a screen for an hour, that go a bit, what my son calls, a bit googly eyed. So if everybody just wants to go and grab a quick cup of coffee, it's now bang on 11 o'clock. So if we reconvene at 11:05, and then we'll kick off again. Okay. Feel like I'm rushing everybody a bit now.
Do you want me to spotlight people, Debbie?
You can do, yes, that'd be really helpful. Actually, I've just just been letting another couple of people in, so you've spotlighted me. I'm going to stop sharing my screen in a second. Actually, I'll just let everybody just come back in. That was maybe the quickest kettle boil in living history, but at least hopefully everybody's had the chance to perhaps, like me, look at a tree outside, or again give their eyes a bit of a rest from the screen. I think these sort of events, they're fantastic in one sense, because you sort of feel like you get through an awful lot. But it's occurring to me before that it would have actually been really nice to have had this, to do it sort of face to face, where you know, after the presentations, you have the opportunity to go and have that cup of coffee and have 15 minutes and sort of chat it through with like-minded people. We can't quite do that in quite the same way. There's some things you just can't replicate online. So fantastic. Right, well, I'm gonna rush forward. I'm going to stop sharing my screen because you can see what we're going to do now, and it just means that we can all see each other a little bit better. There we go. I'm going to close my chat because again I can see you all a bit better. Fantastic. Right, well, welcome back. Hopefully you've all had a chance to grab a drink, and as I say, just perhaps look at the great outdoors, being as we're all talking about sort of the benefits of green spaces and that sort of thing. Give our eyes a rest from these screens. We've heard the background now to the sort of context, and I guess that's sort of the theoretical, why it's a kind of good idea, what needs to be done, the sort of theory behind it all. What we're wanting to sort of just pick up on now is draw that together, is actually chat to some people who are a bit more, as I sort of was describing earlier, at the kind of coal face effectively. So a couple of people I'm going to introduce is Jan Fotheringham from Copeland Borough Council in Cumbria. I think you're pinned now, Jan. Do you want to just give us a quick wave so everybody can see you? There, fantastic. And we've also got Julie Moore. Hi, Julie. Do you want to just give us a wave? From, I can't remember it was on the slide earlier on. I'm going to let you introduce yourself actually, because you're from SOAR, I think, aren't you, in Sheffield?
I am.
Brilliant. I'll let you introduce yourself in a minute then. We've also got Ruth Madder from Bridewell Gardens in Oxfordshire. Hi, Ruth, spotlit. And we've got Wendy from Road Farm Countryways. Hi, Wendy. Hello, nice to see you. Now, I know Wendy missed the beginning of it because she's been busy out doing the actual sort of practical work that we're all talking about, supporting people. So she's helpfully joined us now, though, to sort of talk about that. So I'm just going to pick a little bit up on our sort of social prescribers, I guess, for want of a better description, the sort of in the broader sense. Jan and Julie. Julie, I'll pick on you first. Is there anything, that's sort of come out of this morning that you wanted specifically to highlight? I was going to get you just to sort of give a bit of context as to why you're here and who you are, and also just to perhaps get you to just explain how you perhaps do engage with green projects and what sort of struck a chord with you.
So thank you for inviting me along. So yeah, I am a senior wellbeing coach at SOAR, and we are based in Parson Cross in Sheffield, and we're based in one of the most deprived housing estates in England. So very challenging, and interesting listening to what you were saying, because we've been at SOAR, we've actually been in the social prescribing role for at least 13 years. So to me, I know we at SOAR in Sheffield know all about green prescribing. It's what we've done. And I'm surprised that a lot of people, it's new to people. It's, people are waking up and recognising it. And to me, it's just in our everyday work. It's when we work with 22 GP surgeries, 3 PCNs. And we are overwhelmed at the minute with referrals. So I think just a bit of, because after COVID, it's given us a really good opportunity. We've looked at the positives from this, that moving forward, we can do so much more work outdoors in the green spaces. We did it before, but now more than ever that we need it. So we need all you people out there, all you wanting us to, wanting to get involved. It's absolutely amazing that this work's going to be highlighted and happening, because we just need so many more people out there to refer into. Like I say, I have got a bit of an example. We worked with a lovely lady, Lucy, at Wildlife Trust Sheffield, and she came to us and brought some of her work from the countryside into our estate, into our community setting, which encouraged our clients to take part in it, because we've got a lot of barriers working with our clients. You know, they've no money, they're very anxious, low level confidence, they're just not wanting to get out there still. Even before COVID, they were not ready for getting out and mixing with people. After, it's even harder. So it's breaking down the barriers of we've spoke about before. And so it's all that. It's like, what can we do to help our clients to get involved in your organisations? And I think it's simple, really. We see it simple. The simpler, the better. It works better. So, you know, it's got to be accessible. It's got to be either free or cheap. And I know there's a big, you know, the work around funding. We have a little bit of funding that we can work in partnership with people. It's just them barriers that we're always trying to break down to bring people out and to work with everybody. It's such a hard thing to get through, because, you know, we can assist them, we can help them to get to places, we can work with young people to come to our community settings and then build them relationships up to come out to your settings. So we've done a lot of work with allotments, leaf allotments, down on Herries Road. We've sent clients there, we've referred clients in. One example, a lovely young man, he'd got learning disabilities, really struggled to, wherever he walked, he had 2 bottles of Coca-Cola in his pockets, and it wasn't healthy at all. And the thing that really engaged him was working down on the allotments. He absolutely loved it. He could pick all the fruit. He'd bring berries to us on a walk. He'd come to the walk and say, look, I've bought you a bag of berries, and I've made some soup. I've brought you some soup to taste. And it just was so lovely to see him engaging in something that he didn't have to do his reading and writing. It was hands-on, and they loved it. So
something different. No, fantastic. So how, if I was a sort of a kind of provider, sort of trying to get myself off the ground, and I wanted to find you and sort of find people like you, how would you sort of suggest I went about doing that? What sort of channels would I go through?
We're always open for people coming along to our whole team meetings. So we've got about 40 staff working at SO, and we always like guests to come along and showcase your organisation, how we can work together, what activities we can put on together. That's a really good way. We have got a referral process that we've got, a triage and assessment. The link workers, we've got 3 of them link workers. So that's how we do our referrals through that. Right. But yeah, anybody's welcome to you can get my email address and you can make contact, and we can set up meetings. There's 10 wellbeing coaches in our team. We've got welfare coaches, we've got employment team, we've got community development. So everybody is always wanting to work in partnership, and it's just setting up meetings, and we can talk about how we can work together, and we can set up meetings on Teams, on Zoom, face to face.
So it sounds like those link workers are a sort of useful connection. These were sort of highlighted by Dave earlier on. Jan, I'm just going to ask you, in Cumbria, is your sort of experiences similar to Julie's? Or, you know, is there anything that Dave and Rachel were talking about that chimes with you?
Well, yes, quite a lot, Debbie. I feel like I'm going to throw a bit of a curveball into this conversation.
Go ahead. We like that.
So I am a social prescribing community support worker, but I don't work for the NHS, as you know. I work for Copeland Borough Council, my local authority here in Cumbria, and we do work in a different way. The main difference being that I don't see people face to face. I don't work one-to-one with people. We have social prescribing link workers in Copeland, and we think that we're quite unique in a way, because I haven't heard of too many other areas that have 2 types of social prescribers. Obviously, our link workers will work one-to-one with patients who are referred from GPs. and other health professionals. But myself and my colleague, we recognised that our community groups and services also need support. So that's where our focus is. We focus on our community groups and services that are providing the activities, and we make sure that they have as much resource as they need to carry on, because as somebody rightly said earlier, people who are referred to the groups and services don't have a nice little package of funding going along with them. So we're really keen to make sure that we have as much support for our groups, and that's our primary focus. So I think we are unique really in Copeland, having that focus on both sides of the fence, and we work in partnership with our NHS colleagues. We meet regularly, we discuss themes, what's needed, any gaps in provision, how our groups can expand if necessary. We also help the groups with signposting to funding opportunities. We write letters of support for funding bids if necessary. We help to source volunteers, equipment, new venues, looking for ways that they can expand, as I said, promoting their activities. I send out a weekly electronic social prescribing update to all our groups and services that we have on our directory of resources. We've put together a comprehensive directory of what's out there. It's not covered everybody by all means, but it's a good start. And that directory sits on our Copeland Borough Council website, and anybody can access that, including the NHS link workers if they want to refer anybody onto there. So we have quite a good distribution list to circulate useful information, funding information, training opportunities, anything that the groups might need, any events that they want publicising, we'll do that. We also have a social prescribing forum that meets every 4 to 6 weeks, and all our groups and services are brought along to that, invited along to that. We have 2 speakers, which we try and handpick to make sure that there is useful to everybody that is on the call. And it's a great way of networking, because as you all know, with COVID, it's been a mixed blessing, really. It does mean that people can get together that wouldn't normally travel, because we live in a very rural area. But it also means that we don't have that networking in the breaks that you were talking about, Debbie.
Yeah, it
so,
is.
Yeah, I feel like we have a very different focus, but one that's equally valid and useful.
Rachel's just, I think, yes, it was Rachel in a chat actually, which is a question. It sounds like it's really good practice what you're talking about. Does it sort of get shared around the pilots? Do you know what you're doing? Are you sort of sharing it more widely? The work that you're doing at Copeland.
In terms of nationally,
yeah, nationally. I just wondered if there's a sort of a forum or a way of sort of share. Perhaps I should be asking Dave this. I don't know. I'm rather putting Jan on the spot over it. Dave, is there a way, for someone like Jan to be sharing what they're doing there?
Well, I'm immediately thinking that if they're not already connected, it'd be fantastic if we can connect up with the NASP regional leads, who are sort of almost doing a similar sort of thing at a cross-region level. So, and I should say, when they're doing a similar sort of thing, if the activity at a local level is fantastic, as in the way that you describe, there's less for them to do there. There's other places that it's perhaps not as well established, where they can perhaps then focus their effort and share learning of what works as well. So that would be one way of connecting in. And also through that, we can then flag that to the players who are involved in the individual pilots, the test and learn sites as well. Natural England have advisors who are particularly closely connected with the individual test and learn sites and providing them support. So I don't know if you're connected with your local Natural England Health and Environment lead, because again, that's another good channel for this information. And it's the sort of thing that hopefully the evaluation and research will very much be keen to hear. And I'm not sure myself, a project is being led elsewhere. I'm not sure how they're connecting at a local level, but it may be they've already contacted your local authority to find out more. If they haven't, it'd be good to flag it up. So do please cite us on some contact details at the end.
Yeah, no, fantastic. Thanks, Jan.
And that also should apply to what we've heard from Sheffield as well. I think we're hearing of the diversity of approaches, which is fantastic. There's no one solution to this, but that needs to be spread universally across the country, and I'm not sure it is yet by any means.
No, indeed, that sharing, I think that's one thing, certainly through my colleague Sarah, who's just done so much work sort of building networks and information about this, and sort of sort of gathering information and really sort of contacting different players all around the country. The picture is quite different all across the country. So yeah, I think, as you say, Dave, having that kind of mechanism for sharing is really important. I'm going to just move on now to pick on Ruth and Wendy, because we're, as a sort of organisation, what we do normally, we sort of turn things on its head a bit. For us, normally, we sort of go straight to our sort of our care farmers and our sort of green care providers, and this time we're sort of drawing their experiences in sort of after we set the context. But Ruth, I'm just going to ask you first, do you want to just give a little bit of background about where you're from at Bridewell and what you do, and then, you know, perhaps if you could just perhaps just give us some thoughts on what struck you from a sort of, you know, the provider's angle, I suppose, the sharp end of it.
Yeah, thanks, Deborah. So Bridewell Gardens is in West Oxfordshire, and we've been providing mental health recovery service. So using social and therapeutic horticulture to work with people with severe and enduring mental health problems for 25, 27 years, and pretty much doing the same thing, delivering one service over that time. So our relationship with commissioners and so on has sort of developed over those couple of decades. We are very fortunate to have a contract through Oxford Health, so through the NHS, to provide a mental health recovery service. And obviously who's commissioned that over the last couple of decades, that's evolved, but that's never covered all of our costs. It only covers about half of our costs, and the rest is then fundraising. And then within Oxfordshire, social prescribing, I don't think is as evolved or as advanced as in some other areas. And when we started to hear about it at Bridewell, it tended to be, perhaps it was more the perception, but the tendency was that it was more in that bigger circle, or the middle circle of what different types of nature-based interventions look like. So it was more for public health rather than providing specific targeted interventions for defined groups. But more recently, that seems to be changing. So in Oxfordshire, we've got link workers who are funded by different groups, including in the past few years, Citizens Advice through GP practices, but also Oxfordshire Mind. So we've got a group of link workers who are specifically looking at social prescribing for people who experience mental ill health. And that's one of our most interesting connections. But there's certainly similar story for everyone else, no specific funding that comes through that. So we're still just dependent on that one contract through Oxford Health.
And have you found that sort of, because obviously you've been around a long time, has the sort of circumstances around having that contract changed? Has it become harder to have a sort of contract? Because that's certainly sort of through the course of this project, Sarah and I initially did some work in trying to actually gather more information on the commissioning and sort of referring angles of it. And I think we were quite naive initially that it was going to be a fairly clear picture. And I think, I can't remember whether it was either Dave or Rachel earlier on used the term sort of fragmented. It's very, very difficult, even for us, drawing all this together to be able to create a clear picture, and I get the impression that it's becoming ever more nebulous, really, in terms of this. Is that your sense?
That's my sense as well. When we've looked at similar organisations, and I've been in touch with people with peers in other counties, it's completely different where their funding comes from and what their funding model is. So I suppose we're very fortunate that we are able to access the funding that we have in Oxfordshire, and that there is a mental health partnership within Oxfordshire that includes NHS at Oxford Health, and then a number of much larger voluntary organisations. So we're actually at the moment within the current structure a subcontractor within that because of our size, but we work very closely with an organisation about 10 times the size of us, which is Restore, who also provide mental health recovery services. But it's very fragmented. That's certainly my impression. And I think something that well, both Julie and Jan talked about, with that conversations and being making yourself visible to all of the people who might refer to you is just a continuous piece of work. You have to constantly be inviting yourself to team meetings, whether that's to speak to adult mental health teams, to link workers, to GP practices, because the situation is evolving, and because the individuals there who might be making those referrals, who are building relationships with providers, they change over time, and there's lots of stresses and strains in those roles. So you're always having to rebuild new connections with people who might refer to your service.
No, indeed, I think that that's absolutely true, and I think that whole sort of you know, from a sort of organisational point of view, for us, this sort of advisory capacity is, you know, how do I get started? You cannot underestimate, I think, talking to everybody who's been doing this for a long time, is that banging on the door, knowing what you're going to offer, being prepared to sort of put yourself out there and do that. So, you know, Wendy, I don't know whether you want to come in on this. Obviously, you know, I know a lot about what you guys do. I don't know whether you just want to introduce yourself and just say what your thoughts are on this as well.
Yes, hello everybody, and thank you for inviting us to join this. I'm sorry that I'm skipping in and out rather, but we have people here who I support, and they are different with anybody else, so I need to be there as well. That's we are based on a working farm. We have individuals here, often with learning difficulties, learning disabilities, complex needs, some people with mental health needs as well, older retired people who are isolated or who might have dementia. We have different things on, some different things on different days. So we are partly supporting them. Many people come with a support worker, but because we're on a working farm, we obviously have additional health and safety to consider. I don't know all of the different people here today, but health and safety is really, really important, and you have to consider everybody who comes as being vulnerable, and therefore they need a bit of extra support. With the social prescribing, right from the word go, we've tried to network and communicate with link workers, with social prescribers, with the NASP, you know, the one. We've tried to get involved with that, with all the things that have been around. And then lately, we have been part of a group of organisations within Buckinghamshire that have been called Nature Alliance. And that is looking at how to provide green care solutions, specifically starting with young people, but ultimately making it more easy for social prescribers to find where they might go. So that has been really helpful, because that particular group can network wider for us. We have very limited resources, as Ruth was referring to, and various people have referred to. You know, it's difficult to do everything. Time is limited, and if you can use the skills of somebody else, if they're there and available to help to reach out further, then it's really worth making the most of those links. With social prescribing, we've realised that we need to set up some individual different routes for people to come and be on the farm. So we've, especially with COVID, obviously that started just after social prescribing had started, and has meant that there's been very little consistency with social prescribing workers, because they've had to relocate with their skills elsewhere. So everything slowed down a little, but at the same time, it's introduced everybody to the real need that there is for getting outside in the countryside. We've set up a small what we call our Tent in the Orchard project, which is providing a part of our orchard with a tent in it, which is there and available for people to come out to if they need space and don't necessarily need a great deal of support. So they might come there with link workers, but it's been very, very slow to start, because there needs to be somebody who's kind of pushing it. And if you haven't got enough really with it and enthusiastic and passionate volunteers, it's difficult to do that. And everybody's had these health issues going on. It's been very hard. I'm sure maybe some of you have experienced that as well. But from the funding point of view, we have found that being part of this Nature Alliance has actually given us some access to a little bit of funding, which has helped us to set up a few things for young people, because some organisations are far, far better at getting funding than others. We're not very good at it. We just don't have the time and the resources to put into it all the time. But there are some organisations who seem to have a lot of individuals that they've managed to find all those volunteers, and they're keen to go out and find that funding. So if you can find the help of another organisation, then go for it. It's all about managing to support more people to find a way forwards through whatever challenge they're facing.
It's back to that the age-old what we were just talking about before, collaboration, really, isn't it?
Exactly.
Connections and collaboration. I was just going to say to everybody actually in the audience, feel free, now we've sort of introduced our sort of, I guess, our mixture of experts now. Feel free to put your hands up or post questions in the chat. As I say, I can't see everybody all at once, but you know, if you've got specific questions that are occurring to you now, do stick your hand up. You can either put it in the chat and we can ask it for you, or pop your hand up and you can sort of unmute yourself and have a word with any of the people as we're going along, because inevitably there's probably questions which are occurring. We have tried to do this in a way that hopefully does give you a bit more opportunity to ask questions as they occur. Sometimes it can be a bit tricky in these environments again to ask this sort of thing. While we're waiting for any questions, Sarah, you'll have to stop me if you see anybody with a hand up. You'll have to stop me in mid-flow. I was just going to again rather put probably Ruth and Wendy a bit on the spot actually, and just I mean, we've talked a little bit about the importance of collaborating and networking, and you've heard the sort of background from Rachel and Dave earlier on as well. Have you got any ideas of sort of down at sort of grassroots level as providers, for this to be sort of scaled up, this sort of idea of social prescribing to kind of really take off across the country? Have you got sort of any thoughts on what's needed? I know that's a very big question. Ruth, I don't know whether there's anything any specific thoughts you've got that occurred to you.
Go for it, Wendy.
Sorry, I'm really sorry, but I can't stay very much longer. And I would just in answer to that question, thank you, Ruth.
You go for it, Wendy, yes.
I think it really helps to, if you're scaling something like this up, people like to see feedback. People like to see how they're going to show that whatever you're doing is helping, is having an impact. And if something is to be scaled up across the country, then that feedback needs to be uniform, and a bit of support in knowing what kind of feedback is needed, what kind of forms, that kind of thing. That is what would really, really help people to not have to worry, am I doing the right thing? Am I not doing the right thing? So a kind of a referral form and a feedback form that gathers the really essential information that can then be shown as helpful. We're not talking about forms with hundreds of questions, because nobody wants that. We want something simple that can be replicated.
Fantastic. That's a very, very clear sort of thing to bring up, that is. Dave, I'm going to land on you at NAS, but I don't know whether that's something that can be sort of fed back as a really tangible thing to kind of go into the mix really with it.
You've saved me typing into the chat there, Deborah. Thank you. It's I was actually going to say that's very useful feedback to feed into the test and learn evaluation messages as well, which could certainly feed in. I've also put in the chat the link to the NASP network, which is a way to connect with others who are involved in social prescribing at all different levels, and it also as another way to connect with our regional leads who are very keen to talk to people, capture that learning, but also a great place to sort of go for advice and support if you've got something you're trying to tackle, whether you're trying to find somebody who can provide support for a particular issue, even local funding that's available. I do encourage, if you haven't already built that connection, make the contact with them. And I'll put the page that gives you their contact details in the chat as well.
Great, thanks, Dave. Rachel, were you just about to say something then?
Only that from the chat, Debs from Hands of Hope wanted to ask Wendy something, but she didn't. She can't use the hand up function, so I was just letting you know.
Debs, I can see you, Debs. Hello. Do you want, before Wendy has to shoot off? I'll come back to you in a minute, Ruth, to pick back up on that question with you. Debs, before Wendy has to shoot off, do you want to ask her something?
Yes, please. Thank you very much. Wendy, I wondered if possible, I know you have to go now, could I connect with you afterwards at a later date?
Definitely.
Wonderful. Thank you. Just a couple of things that you've mentioned that I have concerns about. We are putting access into a site for social and therapeutic horticulture and nature-based activities in a woodland as well. And I also have an orchard, which I want to put something like you were talking about just then, like a yurt or a kind of meeting space that we can actually offer out rather than leading sessions. So I think there's a lot there that if I could talk to you, I'd be very grateful. Thank you.
Great. We like it when we put people in touch on these events. Fantastic. Wendy, feel free, if you need to duck out at any point, feel free. And thank you very much for your sort of input and what you said. I think that's been really useful. Ruth, just to sort of come back to you, obviously Wendy's mentioned this sort of idea of feedback. Is that something you wanted to sort of comment on, or is there something else regarding kind of scaling up and developing social prescribing that you've got thoughts on?
I think some of the themes that others have talked about are the only way really to make it scale up and visible more than just a regional level. So for example, the alliances that there are in some counties help bring organisations together, and also having something a bit more uniform in terms of measuring and reporting, not necessarily measuring, but reporting on outcomes as well, so that it's quite clear what each service is providing. So we've got that very well established because we need to, part of it with our contracts, but also a third of our funding coming from trusts and foundations each year. You have to have very strong outcome measurements, and you need to know what impact it is that you're trying to achieve. But we wouldn't expect every service to be trying to achieve the same impact and the same outcomes. So it's not about making that uniform, but being able to report it quite visibly so that social prescribers can identify the most suitable service for the person that they're supporting.
Fantastic. That's useful. I'm going to ask Jan and Julie to come in on this now, actually, from their point of view. I think there's both very helpful points from Wendy and Ruth. Julie, when you're sort of looking at sites, what sort of evaluation, I guess, do you do in terms of sort of referring people onto them from your point of view? What do you look for?
Well, it's holistic. We look at the holistic approach of the health. So we'll support somebody with emotional well-being, mental health, physical health, and everything like that. So we have a look at what it'll improve in their health. So, it's sort of an example is we do a lot of walks. So we'll start off on a very gentle walk from Sow Building to a local park, and we'll see how they go with that. And then we're starting them off very low level, and then we build it up and then go into bigger things. But for evaluation, we do individual valuation for our clients. So we have what's called a wellbeing questionnaire, and all we do is the questionnaire at the beginning, at the end, and we ask a sliding scale and how are you feeling from 1 to 10 today. And usually when we start working with them, it's a no, it's, they've hit rock bottom, they're very depressed, they're very isolated. And as the interventions go on, we sometimes do one in the middle if they're willing to, because we don't always want to ask the client, for the evaluation. And then at the end, we do one, and it always nearly always is improved. And so that wellbeing questionnaire feeds into our bigger evaluation. So then we're funded by PKW, People Keeping Well, with Sheffield City Council, and so then our monitoring goes into them, but we do use the evaluation forms with our clients as well. Is that sort of answer that, or of a warble?
Yeah, no, that's fine. Is it similar for you, Jan, as well? I think that's pretty.
We don't actually, as I say, see people face to face, so we don't get evaluation that way. Our project's only been going for a year, so we're quite new. We have got some feedback forms that we share with our groups, and we get data from them each month, and that's really about who's been referred, rough age range, what activity they've been referred on to, and that's pretty much all that we measure at the moment. Yeah, I mean, we do have 67 groups on our directory, so it's quite a big job to keep on top of that, really.
Yeah.
And we're a small team. I'm part-time, so I work 3 days a week. My colleague works full-time, and there's a lot of unseen work in all this.
Yes.
In terms of getting data and feedback that I don't think people who aren't in this business realise. I didn't realise either until I started. So it's an ongoing project, really, from that point of view.
I'm just looking to see whether I'd seen a question actually in the chat. I was just keeping an eye while I was here to see if anybody got any hands up while I'm busy asking things, whether there's anything that anybody else is wanting to cover. You'll have to, as I say, wave quite wildly at me. Caroline's just asking if there's anybody here from Surrey over a small woodland hoping to be used for nature-based interventions to benefit young people. So if anybody can see that in the chat, do pick up on that. Yes, sorry, I'm just looking. I'm just flicking between the screens. Is there anybody waving? No, we're fine at the moment over that. Dave,
Debbie, am I allowed to ask a question?
Yes, I was just, to be honest, I was just about to come in, actually. I was just double checking that nobody else within all my many tiny little boxes had got something burning. But yes, I was going to ask Dave and Rachel now, actually, whether you wanted to come in and ask anything.
I just had a question for Julie and Jan, really, just a quick sort of idea of what sense of the proportion of the social prescribing initiatives that you are referring people to are green or nature-based. Because when we first did our study, there was it was a tiny proportion. And I guess I'm sort of hoping that with COVID and with the growth and everything that we're now seeing that has increased. So it's just out of curiosity, really.
Yeah, for us, yes. And it is, I'm excited that it's going to increase more. So I have tasked our team of wellbeing coaches to go out into their different areas and find out what else is out there, what we can work in partnership with in green spaces, because I want to encourage everything outdoors because of COVID. In the past, we've sat in a room together and we've talked about things. It's about using our coaching techniques and getting out there and getting people out into the countryside and what's on your doorstep and what, you know, your local allotments, growing your own veg, because we do cook and eat sessions, so we want to grow our own veg. We have done that in the past. So I think percentage for us, probably 30% is, and I think that's due to probably the clients being not motivated to change just yet, but you know, it depends on what clients that we get to work with. So they're not always willing or see the advantages that we see. So it's ongoing all the time to try and explain to our clients what benefits of the outdoors and nature and how it will impact on their emotional well-being and how it will improve all that. So we're always banging on about this. So hopefully moving forward, if it was up to me, it'd all be outdoors, whether it's raining or snowing, but we have all that to take into consideration, don't we?
No, indeed. And I think there's a responsibility on sort of all us as, say, sort of social farmers and gardeners to sort of represent and promote how good, you know, sort of these sort of projects are for you, and in turn support, you know, anybody who's doing it to sort of help them do that as well. So yes, I think that is really important. I'm just keeping an eye because I'm just trying to get us back on track time wise, because we've got some lovely slides from Sarah which I want to share with you before we wind up. Before I go on to her, Dave, is there anything else that you wanted to sort of bob in and say?
I think one of the challenges we always have with this is to connect with those in most need, in actually reaching deep into the communities. And we get, obviously at the moment, there's lots of people referred and who have come into the system already. From your experience, how do you reach those deepest in the communities who potentially could benefit, but that are not necessarily comfortable to come forward into the NHS, the GP system? That's a challenge. I don't necessarily expect answers, but that is an interesting challenge that would be interested to hear any good practice on.
Anybody wanting to answer? That's a very good question. That is, Dave. John Broadbridge, actually, I can see you've got your hand up. John from Dorset. Do you want to just pick up on that?
Hi, Debbie. Yeah. So something that we are doing currently is we're working with well, two specific groups. One is called the Volunteer Centre in Dorset, and they are referring people to us not through NHS services, but through sort of community groups. Another one is called the Dorset Mental Health Forum. And again, it's not specifically around NHS services, it's sort of community groups again. So we're sort of doing quite a lot of outreach into the community at the moment, and also into drug and alcohol services, to sort of try and find those groups of people who not necessarily in CAMS or in NHS services at the moment, but who might be in need of the sort of things that we do here. So that's one thing that we're doing. Also, if it's okay, I wanted to sort of pick up on a point about outcome measurement and evaluation. And it's something that we're trialing at the moment, which is we've sort of created our own, we call it a green care diary. So rather than specifically looking at measurements at the moment, we are, for all our volunteers that come in, our supported volunteers, we are giving them a green care diary based around 8 areas. So skills, tasks, the social aspect of things, their body, their mind, how they're feeling when they're here, but not asking them to sort of measure themselves, but simply to express themselves in writing or in pictures. And then we're using that on a sort of monthly basis to go and then have an evaluation, which we're tying into the NHS's 5 steps to wellbeing. So it's only at that point on a monthly basis that we then sort of do a sort of an evaluation. But rather than an out of 10 measurement, what we're doing is a -1, a -2, -1, 0, sort of a change, +1, +2, change over the course of the month, specifically on how they've been while they've been here. So that's how we're currently measuring things. In addition to that, we also, in terms of the work that we do with equine interventions for people with mental health problems, we've done a lot of research and had studies done by Bournemouth University. So we've got a lot of specific psychological evidence that, and serious studies that have been done. And that's something that, I mean, we've been very fortunate to have the contacts to do that, but I would recommend that if anybody can find connections with universities and psychology departments, to find those ways where you can get that sort of more evidence-based research done into the work you're doing. That's what we found has been sort of really supportive in the work that we've done to have more people be referred to us and sort of get the word out that we're a sort of a serious business. Because I think there can be a risk at times that green care can be perceived by the wider public as a bit wishy-washy, and that's it's obviously not the case, because we know the benefits of it. But having that specific university-led measurement of what we've done carried out, so we've had studies done around, for example, the impact on domestic violence for people that have come to us and been referred to us. Just gives that bit more oomph to what you're doing. It's difficult to get set up, but it's really worthwhile.
Absolutely, and I think sort of what we're moving into is a big subject, and a subject which I think, you know, a lot of people are very interested in. We have run a sort of overview webinar, but I think, John, absolutely, there's some scope, I think, for us to perhaps run something to sort of take this further and discuss it in more detail, because as both Rachel and I know from a lot of other events, it's an area that always has a lot of, you know, a lot of interest, is sort of growing interest, and that we can easily lose 2 hours just to that sort of subject and discussing it. So I think if there is appetite, we would we'll look to take that further. I am going to have to just wrap things up, just time-wise. I'm just looking, Debs, that was John Broadbridge who was just talking then. John's from the horse course in Dorset, if anybody wants to look them up. But yes, I'm going to just rush on because I'm just conscious of time with 10 minutes left, and we did promise some top tips really on green social prescribing, and Sarah's put something really nice together. I'm just going to share my screen again. If I get the right screen. There, can you see the right screen, Sarah?
Yes, I can.
Yes, you can. Fantastic. So here's Sarah, our fantastic regional support officer, who has got an incredible overview and understanding of the pilot project. So I would certainly say contact her. You know, if there's any sort of follow-up that you want to make in terms of sort of connections, do contact Sarah after this event. But I'm just going to hand over to her and move on the slides. Sarah, I don't know whether you just want to run through these top tips, which we've sort of drawn together really with the experience of talking to a lot of people over the last few months.
Yes, yeah. Well, I mean, to be fair, a lot of the information that's in here is replicated. It's already been talked about, and the points that have been made by other speakers and panelists already, really. So the first one is just absolutely to be clear on your offer. So again, that's returning to what Rachel was saying, understanding where you fit within those 3 green circles, and whether what you're offering is green care, or whether it's more of an open drop-in session, volunteering opportunities on a green care site of some other well, of any description really. And really understanding what levels of need you can work with. If you are a voluntary group that are working on a community allotment, for example, then the skills and expertise you have is going to be different to those who have those specialist training and working with people with defined needs. So be very clear and sort of internally, but also externally communicating what you can offer, and fully understand what your costs are as well. And, you know, I think it was Ruth was saying, you know, that they are aware they've had this contract for the recovery services for a long time, but it doesn't 100% fund them. And you will find that that's the case with most green care providers. But understanding what your actual costs are, how to work out what the full cost recovery is, will make sure that you can kind of make decisions as to whether something is going to work for you or not, whether you can offer those services, or whether that's going to kind of put more pressure on your organisation than it is going to help it. So really, yeah, capacity, understanding your offer and communicating that offer. If you could move on to the next one, Debbie, please. The second one is just generally about raising your profile, particularly with those green social prescribing pilots, if you happen to fall within one of those areas. And I do realise they don't cover the whole of the UK, but the other thing to do is just to remember, if you do fall within those areas, the vast majority of them have allocated a certain portion of that DEFRA government funding towards basically pilot projects. So a lot of them are actually have opened already for applications from providers to potentially get funding to pilot activities in those areas. So as I say, do check that out. Again, you know, it's been talked about a lot already. The importance of networking amongst peers is obviously really useful to get a feel for how everybody else is dealing with things. But also we know from, well, the last webinar we did, Jenny Street from Rhubarb Farm was saying how important even going to business networking events have been to her, to make connections, to gain support, to gain potentially finance and funding, but also to gain, you know, really skilled trustees and volunteers. I also, you know, encourage you, as we have done all day really, to speak to your local social prescribing team. If you're not sure who they are, where they are, then a little bit of Googling, and if that doesn't help, then contact your local infrastructure organisation, you know, that supports the voluntary sector, because they will often be linked in to the social prescribers in whatever setting they're in. And also, again, something that probably everybody's doing already is just trying to use that social media that you have to promote your organisation and spread your reach. The more people that know, the more chance you have of getting those referrals through. The next tip is slightly more wide than just green social prescribing. It's actually more about commissioning as a whole, really. And that's about the importance of understanding the changes in the way that commissioning is happening within the NHS, the fact that clinical commissioning groups are now being replaced by ICSs, integrated care systems, and that decision making around commissioning is going to be going down to a real macro place level. So it's really important that you try and link into your ICS. A lot of them are setting up networks and are encouraging providers to be part of that. I appreciate that it all takes time, and that is something that we're often very short of, but if you can link in and be part of that network, then you can feed your experiences in, both on a sort of a delivery level, but also the knowledge you have around the clients that you're supporting and serving, and it ultimately help direct funding to where it's needed most. And that's, you know, really important, a huge shift in the NHS system and the way that things are being commissioned. So that does link into social prescribing as well. Tip number 4. Now, I was going to end on this, but we decided to kind of swap it around a bit. I think it's really important that people know when to say no. So as we know, there's lots of people saying, well, we want to engage with social prescribing, but there's no funding and it's just really difficult to make it work. Take advantage of those social prescribing teams and their knowledge and their local connections to see if they can help in any way, whether they have their own budgets or whether they know of smaller pots of local funding, or whether, you know, they think the person might be eligible for some other sort of social care or education funding, whatever. But unless it's actually going to work for you, unless you can find a way to fund it and for it to be mutually beneficial, then take a step back and concentrate on what your key work is and the way you are getting the income, because stretching your organisation isn't going to help. What you need to do is kind of communicate those enablers and the barriers that you're facing. So trying to sort of stay connected and linked into the networks, but understand, we've said it so many times today, Dave said, you know, it's moving on a pace, but it is still evolving, and ultimately how it's going to become sustainable isn't yet obvious, but you have to be in it to win it in a way. So you've got to kind of stay connected and try and sort of figure out as a whole community of people how that support and funding can come online in the future, hopefully. And finally, we just wanted to say and reiterate what's already been said: seek out support and collaboration. So there are lots and lots of peer support networks all over the country. One of the things I've been trying to do through the Resource Roundup newsletter that I send out monthly is flag up any of them. So I know that we've got someone here today from the Norfolk Green Care Network. We've got basically Yorkshire and Humber has its own care farming network. But there's also, I've picked up on them in Southampton and Reading and all over the place. So if you can't find anything locally and you want to know if there's something in your area, then if you could kind of contact me on my email address, rso@farmgarden.org.uk, and I'll try and do a bit of digging for you or put you in touch with someone if I know that there's something there. But ultimately, if there isn't, why not try and start something of your own? It's, you know, very easy. You don't have to meet very often, but that's how all of these peer support networks tend to spring up, from people kind of realising that there's a need for everyone to get together. Social Farms and Gardens do run virtual member gatherings every month up until the end of December. Within the GCF project, we're also running our monthly care farming network meetings, but also the infrastructure organisations I mentioned also often run networks or are linked into various networks. Sometimes it's mental health, sometimes it's physical health, young people, etc. So find out about what's happening in your area and think about how you can combine expertise and potentially develop a consortium in your area to secure funding and to deliver together. So the alliance that was mentioned earlier on, I think that type of approach is going to be more and more important as we move forward, because as individuals, you know, we only have a certain amount of time and a certain amount of skill, but together we can be much stronger and make a much better offer.
Brilliant.
My 5 tips.
I think they're absolutely fantastic. I think the fact that, you know, you sort of drawn those together, it's really almost sort of drawn together everything that's been spoken about actually today anyway. And we will certainly share these. We're sort of under discussions about sort of putting these in a slightly different format and sharing them via social media. And what I would say is we're not going to ask you and put everybody on the spot now, but do feed back to us after this. You'll get a feedback form after this event. So if you could fill it out, that would be really, really helpful. I know it can be a bit tedious sort of filling these sort of things out, but it would be really good. And if you know there's anything that sort of springs into mind that anybody has thought of, please do contact us about that. And that's just a final slide, which again gives Sarah's actually mentioned the other email address, which is her direct one, which would be RSO, Regional Support Officer, so just RSO at Farm Garden, and that's our Twitter handle as well. We like Twitter, so do contact us. So I'm just going to stop sharing my screen just for the final bit, just to say an enormous thank you to Rachel and Dave for drawing that together, and then to Wendy and Ruth and Julie and Jan for sort of bringing that kind of real life context to how it's working in practice. I think it struck me earlier on actually when I was listening to the speakers, this would have made a really lovely face-to-face all day event where we could really have got stuck in actually and really teased some nitty-gritty out. But I think 2 hours is really the maximum. I think for us all to be staring at screens, it gets a bit much otherwise. And no doubt everybody's sort of bouncing on to other events. So hopefully you found it useful. I think we've taken some very interesting things from out of here as well. And I certainly think we've talked to the team before, you know, expanding and looking more into this sort of, you know, the evaluations, the outcome measures, this sort of thing. So it's certainly something that we would be interested in taking forward. But keep in touch with us. This may be something we've had a lot of interest in. You know, if you'd like a sort of follow up or a bit more detail, then we're always interested in feedback and taking things forward. But thank you all very much. It's been lovely to see everybody. Yes, keep an eye on our web pages for our next event. Okay, thanks all. Thanks so much. Bye bye.
Bye bye.
Bye bye.